Morning. Can everyone hear me? Okay. All right, so while we're getting up my slides, which seem strikingly similar to Katie's, thank you so much. That was a perfect introduction. My name is Jennifer Bain. I'm a child neurologist at Columbia, New York City. But my other hat is that I work with Searchlight. For those of you who don't know about Searchlight, I'm going to go a little bit through this. I think this is a wonderful resource for both patients and families, such as Amber and the group that she's really bringing together today, but also for researchers and clinicians. So I think for the clinicians out there in the audience, as a clinician myself, I often do come up with these rare diagnoses, and I'm really limited in what I can do. And yes, I can get excited and tell them that there's lots of research going on and that potentially in the near future you can engage in that research. But really, I think having the parent support is really critical at this early stage. And as I think most of the researchers would agree today, having a natural history study of these types of super rare disorders and having it combined across different sites is really integral to doing any potential therapeutic intervention. And so I think what's actually really perfectly done today was that I'm actually going to follow up exactly what Katie said. And this is information that's provided by families. So families provide this information, and now I'm going to present that to you today. What Katie presented was all the literature. So what's awesome is, guess what? They match up really nicely, and I think it's actually one of the first and few family meetings where the Searchlight data is really closely aligned with what's out there in the literature. So I think this is a really amazing opportunity for your community to come together and use this resource. So the goal of Searchlight, this is an endeavor that's basically put out there for free for parents and families, researchers, and clinicians. What it basically does is it allows collection of medical histories from families. So this is all parent-reported measures. It also allows for behavioral interviews, different scales, standardized surveys, and questionnaires to be done remotely. So this is over the phone or on the internet. So people from all abroad, as long as they're English speaking, as well as other languages coming into play, can collect all of this information in sort of a library. What Simons also does is that it collects biospecimens, whether that's blood or fibroblast samples, et cetera, and makes that freely available to researchers. What Simons then does is takes all that information, puts it together like I'm going to today, and has it available so that researchers can take this information, they can synthesize, go into deeper questions based on the data that we've collected. This data is freely shared to all clinicians, all researchers, families, as long as you've been vetted by the Simons Foundation as an accredited researcher, and it really allows participants to connect from around the world. So Simons enjoys and is based upon linking up families and being an integral part to research and moving science forward, and really to promote better understanding of what these genetic changes are. Searchlight was originally called Simons VIP, which is Variations in Individual Projects, so you might have heard that before, but last year rebranded to Searchlight. It began about almost 10 years now, 2011. It focused on a group of families that had one specific genetic change, and at that time, all the participants traveled to one study location, and they had the conference data collection all together. Now it's become much more remote and utilizing technology more broadly. And it collects this medical, behavioral, and neuropsychiatric data. Today, families living with one of more than 170 different gene changes have been collected in the database of Searchlight. What is available, what is potentially utilized by the Searchlight platform? Again, medical records will be collected, can be collected by Searchlight, but the vast majority of data that I'm going to present today and that's available is based on parent reports. In order to become a member or to become a participant in Searchlight, the individual must consent through an IRB process. They must provide a clinical genetic report, which then gets reviewed by a medical geneticist, by a genetic counselor, and a medical review. And then there's phone interviews and online surveys. This could include anything from a basic medical history interview, which is what I'm going to present today, but then there's many other online surveys that are used for across most of these genes that we're looking at. Furthermore, if there is an interest or a specific data or question that you're interested in, researchers can go and even provide a specific survey targeting specific questions within a group. So today what I'm going to be presenting is the data collected from parents in this registry. And as Amber already said, you guys did an amazing job. From what I heard last year, it was a much smaller forum. And so right away, we can say the interest is definitely there. And in the Searchlight sign-up area, we have about 64 subjects registered. 44 have been consented and their labs have been reviewed. 32 of them have been considered or deemed pathogenic or likely pathogenic. The 7 additional variants of unknown significance are included. Data is being collected, but they're not going to be included in the data presentation today. And an additional variant in PTPN11. What I'm going to be presenting today is 27 medical histories, standardized, considered pathogenic. All right. So in terms of the different variants that are being looked at in this group. This is 40 of the individuals that have presented their information. Similar to what Katie had mentioned, there's a pretty wide variety in terms of what the genotypes are in this group. Anywhere from mostly, it sounded like missense mutations, likely gene disruptions, small deletions, small splice state variant mutations. And then on the bottom, I included the variants, though the medical history information won't be included today. So the medical history I'm going to be reviewing is of 27 individuals. The youngest was 20 months of age. So again, it sounds like most patients do present before 2 years of age or around that age. But we do have adults that are included in this cohort as well, which is going to be critically important to these natural history studies of what's going to happen to individuals with this genetic change. Similar to the data presented earlier, the majority of people who come in Simon's Searchlight have a history of global developmental delay. Simon's Searchlight is there for neurodevelopmental disorders with a genetic change. And so 80% of individuals have been diagnosed with intellectual disability or global developmental delay. About a third of them, similar to the other reports, have autism spectrum disorder. Several have reported having regression due to these seizures, attention deficit hyperactivity disorder, obsessive compulsive disorder, anxiety, oppositional defiant disorder, dysthymia. Only one subject reported having no formal psychiatric diagnosis. In terms of eye and vision problems, there does seem to be a slightly increased risk of vision difficulties in the group, being nearsighted, having strabismus, astigmatism, other visual difficulties, and hearing problems. And again, because this is a neurodevelopmental disorder, not uncommon that we have mostly neurological issues being described here. The majority do have hypotonia or low tone. A movement disorder is noted in over half of the individuals, but there are additional individuals who report being clumsy who may not have a formal diagnosis of a movement disorder. Hypertonia, which is increased tone in another set of children. Some children have larger heads, macrocephaly, some have smaller heads, microcephaly, but in general, most are normal cephalic, and one reported having tics. In terms of seizures, this is very similar to what the publications out there are showing, and I think this is really important to show that this data set is very representative of what's in the publications out there. 80% of individuals do have an epilepsy syndrome, and the majority of them are absence seizures. Some have drop attacks, a few have myoclonic, febrile seizures, simple partial spasms, and generalized tonic-clonic. The age of seizure onset in this group was 5 months to 2 years of age, which is, again, very similar to the published literature. The most effective medications reported out of 9 individuals were Depakote, valproic acid, clobazam, Zurontin. There were 3 individuals who reported an allergy to lamotrigine. GI issues, not uncommon in neurodevelopmental disorders, so constipation was increased in this group certainly, as well as gastric reflux or heartburn. Diarrhea was reported in one as well. Infections slightly increased than the general population. Most of these are children, but most children do end up having ear infections at one time or another. So I'd say there really isn't too big of a difference here in terms of an increased risk of infections in this group. 59% report having had a middle ear infection. Some have required ear tubes, pneumonia, and UTIs. along the same lines with respiratory issues, doesn't seem to be a slightly increased risk. In terms of overall body and how this gene seems to be relative to the rest of the body, there actually does not seem to be significant issues with body growth. So while there might be GI issues such as constipation, really gaining weight and difficulty growing is not a problem in this group of individuals. So only one person is reported having a difficulty with gaining weight or growing. One person reported having low thyroid. One person had undescended testicles and other GU concerns. So really not too many systemic effects that we're seeing outside of the brain in this group. In terms of bone abnormalities, 2 individuals had scoliosis. A few had other random musculoskeletal orthopedic issues, but again, does not seem to be a large systemic effect from this gene. In terms of surgery, so similar to the ear infection, several of them did end up having ear tubes placed. A few extra people with broken bones, a tongue tie repair, an eye surgery from strabismus, and a hernia repair. But again, not a significantly increased risk of having some kind of surgical repair. So in general, so I think the take-home message here is that this is a really wonderful opportunity because your group number 1 has included a lot of information, so thank you, because this would not have been possible except for parents and families who are willing to put in the time and the effort to put in this data. This data is very representative of what's out there in the literature, and so it's really critical to continue to engage your parents and your families to give information to Simon Searchlight and make that information available to everybody. I think this is a really great opportunity for your group to continue collecting data in a very standardized and validated way and be able to provide that information to the research community. It's really critical. So actually, instead of, I know you guys are going to give me a hand, I want to say thank you to the parents, and we're going to go like this because they've done a really great job. So thank you from Simon Searchlight. You really are the ones that are driving the momentum of Simon Searchlight. What you have taught us is that seizures seems to be a common issue, as well as developmental delay, movement disorders, low tone, and autism, which is exactly what is out there in the literature. So keep it up, and thank you very much for having me here. Keep up the great work.